Hello, in this video we'll talk about constipation. The video will guide you about dietary habits and lifestyle changes that can be adopted to provide relief to your child from constipation. Constipation is a common issue where the stool or feces or potty or poop becomes hard and gets stuck in the large intestine, which is difficult to pass out of the body. Constipation occurs due to less fibrous food, less consumption of water, and no exercise. Constipation can be identified through symptoms like less than 3 stools or potty within a week, longer duration and more pressure is felt by the kid during passing of stool, very hard stool, or bloating and pain in the stomach. Before we get in the depth of constipation, it is very important for us to understand the normal functioning of digestion of food in the stomach so that it doesn't lead to constipation. When we eat, the food is broken down and the nutrients from the food is absorbed by the body to carry normal body function. The leftover food or residue is excreted or disposed out from the body as stool. This stool becomes soft and bulky depending on the amount of fibrous food and water consumed. More the fiber and water, more easy it is to pass the stool. If the child eats junk food or drinks less water, the stool becomes dry and hard and is stuck in the large intestine, which is known as constipation. Adding proper amount of fiber in the food and water makes digestion easy and softens the stool, which is easy to pass out of the body. The various causes of constipation are eating refined food with less fiber, which affects the digestion and makes the stool hard, or not drinking proper amount of water, which again makes the stool dry and hard, or less exercise and playing outside, which is a common problem with the growing use of cell phones these days. To prevent constipation in kids, there are 5 important things that has to be taken care of. Eating fibrous food, drinking adequate amount of water, avoiding junk food, sweets and carbonated drinks, doing exercise or playing outdoors, and proper or modification in potty training. When the food doesn't contain proper fiber or water, stool or poop gets stuck in the large intestine. Fiber is very important in digestion. Although it doesn't break down and passes out as it is, it helps in absorption of water and adding bulk, which makes the stool easy and soft to pass out. Fiber can be found in fruits, vegetables or pulses. It is important to include seasonal fruits like apple, pear, watermelon or papaya in the diet. Salad like cucumber or tomatoes should be included and increased in the diet. Other green leafy vegetables like spinach, broccoli, carrot can also be included. Chapati, dal, porridge, dates and walnuts are rich in fiber. On a daily basis, 2 serving of fruits and 3 serving of vegetables should be included in the diet. Refined food like cornflakes or rice balls should be avoided. Just like fibrous food, water is equally important. It gets absorbed by the food and softens the stool. During summer, when perspiration or sweating is more, the water intake for the child should be increased. Children should drink proper amount of water according to their age. For a child of 1 to 3 year old, 4 cups of water should be given. For a child of 4 to 13 years of age, 5 cups of water is required, and that above 13 years of age, 8 cups of water should be given. If your child is above 18 months of age, restrict milk or milk products to 500 ml per day. Though milk is very good for development of body, it gives a feeling of fullness after which the child doesn't eat food. Avoid fried and junk food, sweets and carbonated drinks in your child's diet. During constipation, helping a child pass stool can be a bit challenging, but with the right approach and patience, it can be managed successfully. You should encourage your child to sit on the toilet after breakfast, lunch, and dinner, even if they don't feel the urge to go. The child should be seated on the potty chair for at least 10 to 15 minutes. It may take some time for the child to pass stool during constipation, so be patient and offer encouragement. Understand your child's cues and give them the time they need. Sitting on an Indian style toilet can be very helpful during constipation. The child's knees should be positioned above their hips. They should lean forward while sitting on the potty chair or toilet seat. If their feet don't reach the floor, you can use a footstool to support their feet comfortably. We hope that the following diet and guidance given in the video will provide relief to your child from constipation. Follow the 5 important points on fibrous food, water intake, exercise and playing, avoiding junk food, and modifying potty training. Even after all this, if your child is still facing constipation, then consult your doctor. Eat healthy and stay hydrated. Thank you for watching the video.